How are you doing? I hope you have been having a fantastic day. You are welcome to Life Class here. This is where we talk to the young people, teenagers, on things that will help them, give them information that will help them make healthy lifestyle choices. You're welcome. I am Adama Sparkles, and I am here to do what we do because we love you. And so, if you are a teenager, if you are a young person, this is for you. Or if you are someone who loves a teenager or a young person, this is also for you. You're welcome. Today, we'll be talking about understanding sexual health for girls. All right. And it's when we talk about sexual health, it's all about preventing disease, knowing your body, making informed choices, feeling confident and safe. So, if you are a teenager, if you're a teen girl, if you are a mother, if you are an instructor, this is for you. And so we will be defining sexual health according to WHO. We'll talk about its importance for girls and women. And then we will also want to break the stigma around sexual health, talking about sexual health. Some people think it shouldn't be talked about, and I don't believe that, because it's information that will help us make healthy lifestyle choices, not just in any kind. And today we are talking about understanding sexual health for girls and women especially. Okay, now, like I said, we are going to be looking at the definition of sexual health from WHO, World Health Organization. Now, sexual health is important to overall health and well-being of every individual. Everyone. Okay, the fact that we are talking about girls today doesn't mean boys should not be concerned about sexual health. All right, but we just want to look at it from the aspect of the female child. And having sexual health, being healthy sexually, will mean that you have access to comprehensive and not good information of your sexuality, right? And then when you have such knowledge, it will help you not make risky decisions or not get involved in risky acts that would disturb your life as you grow. All right, so that's why we talk about sexual health. Now let's look at the definition of sexual health from WHO. Now, according to WHO, now the current working definition, these things change over time, right? As the world evolves, so many things will have to be included in a definition of a particular thing. So for this, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Now, sexual health requires a positive and respectful approach to sexuality and sexual relationships, and as well as possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Now, so you see, they have brought in a whole lot. Not in fact, the part about sex even came last, right? So they brought in the physical, the mental, the emotional, and social well-being in relation to sexuality. And for this to be attained, the sexual right of all persons must be respected, protected, and fulfilled. Respect, protect, and fulfillment. Okay, so all of these things will have to work together when we are talking about sexual health. Okay, now let's quickly look at some key aspects of sexual health for the girl child. All right, remember, you can still transfer this knowledge to include the boy child, but today is about the girl child. And so we're going to be looking at the basics of sexual health. All right, and it's large. So we'll just take one or two that will be generalized. If you want to go into them one by one, we'll not leave here today. But then we'll talk about the basics of sexual health. We're looking at puberty and menstrual health. We're looking at understanding the anatomy, which we may not really have to talk about here. We're looking at consent and boundaries. We're also looking at the importance of hygiene. Oh yes, very important. Okay, so let's look at some key aspects that you need to understand right now. The physical well-being, we cannot remove that part. Okay, now this is where you are actively involved in preventing sexually transmitted infections and unintended pregnancies. Yes. Okay, so why did I say you are actively involved in? This is not the part where the parents will just have to tell the children, don't get involved in early sexual activity or something. You, as the young girl, will need to understand that you should be free from sexually transmitted diseases, STDs, or unwanted pregnancies. If you get pregnant before the intended time, right? And the intended time is always after marriage. So if you get pregnant before that time, it will stunt your growth in many ways. Now, for some girls, they get lucky when they get pregnant before the intended time. They get help. The family is there. And sometimes society is there for them. But it doesn't happen like that for everybody. For some people, they get to struggle through life, or in fact for the rest of their lives. Just that one time of having a child before the intended time. All right, I am intentionally adding before the intended time because there is a time for it to happen and it will be okay. But then as a single young girl, as a teenager, you get pregnant without getting married, then you have to fend for yourself. Sometimes the family may abandon you, society will not be there for you, and even the boy or the guy who got you pregnant will be living his own life. Then you are stuck with a child. You are stuck with raising a child as a child. And most times, if you were going to school before this happened, you'll find out that school will end for you. You can only take the grace of God for you to move further from that point, especially if you're coming from a background where there's not much money, not much education, and all of that. So if you're coming from the rural area, sometimes you find it difficult to get back on with life. Okay, so physical well-being, what we're talking about, physical well-being is about you actively involved in preventing sexually transmitted diseases or infections. And when you have unprotected sex, you can get sexually transmitted infections. And there are so many other ways that we can get that, even apart from sex. All right, but we need to be very, very careful. And as well, when it comes to physical health, we are also looking at addressing any physical dysfunction or pain related to your sexuality, sexual function, for the women especially, or any kind of physical dysfunction as a young girl. All right, there are some things we shouldn't be taking for granted. I always say that here. For parents of every young girl, there are some things you shouldn't take for granted. When the girl is complaining about anything about her body, take the girl to the hospital, check her out. You never can tell. There are so many things happening inside the body that we don't see with our physical eyes, except you go for a test that is intended to see that particular problem. Okay? Now, another key aspect of sexual health is the emotional and mental well-being. All right, now this is where you get to be comfortable with your sexuality. You get to be comfortable with your identity, your gender identity. So you are a girl, and you're comfortable with being a girl. You are a boy, you are comfortable with being a boy. And also here as well, sexual experiences come to play. Now, these sexual experiences may not be very pleasant for some people, especially in the case of rape, physical abuse, sexual abuse of any form. It can affect the emotional and mental well-being of any child, especially the girl child and the boy child as well. Okay, and so for this part, this mental and emotional well-being, we need to discuss any negative emotions or thoughts related to sexuality. All right, and for me, one of such negative emotions is when you start feeling uncomfortable with your gender. And when you start feeling like I'm not meant to be a girl, meanwhile you were born a girl, created a girl. From where we are, where we come from, this climb, all right, we are comfortable with our gender. So if you're born a girl, you grow up a girl. If you're born a boy, you grow up a boy and do things that are expected of you as a boy or as a girl. The moment you start feeling like something is wrong, then you equally need to get help for yourself. All right, very important. Then another aspect of sexual health is a social well-being. Oh, this is where we get to talk about having healthy relationships with people, having healthy relationships with same sex, having healthy relationship with the opposite sex. As you grow, you get to meet people. You get to mingle with other people apart from your brothers and sisters. And so you should learn to have healthy relationships, communicating effectively with your friends. For you as a young person right now, you should learn to communicate effectively with people around you. When you're comfortable with something, you talk about it, you allow it. If you're not comfortable with something, you should not allow it. And this is also where we get to see cases of bullying, all right, both cyberbullying, physical bullying, things that will not go well with you, things that if you don't know how to address them socially, you may not be able to mingle with people. And so these are things, key aspects of sexual health that we should equally look at. This social aspect of it, where young people are meant to be free, mingle with other young people, mingle with elders in the society, mingle with the school environment, mingle with different kind church environments, wherever it is you find yourself. This social aspect of it is very important. All right, you should be able to navigate social norms and expectations. There are social norms and expectations, and sometimes these social norms are not talked about. You observe them, you experience them. All right, you come into a place, you're expected to look at how that place is working, come into a school, understand how the system works, especially the part of the system they don't talk about. There are lots of things they don't talk about that you're meant to learn. That will show that you are socially intelligent. So it's very important that you become socially intelligent as you grow. These are things that are expected. And then reproductive health. And now this comes to, this is the part where we talk about contraception, again, pregnancy, unplanned pregnancy, early sex for girls who you get involved in sexual activities where you shouldn't, and even for the boys, you get engaged in sexual activities where you shouldn't. And some people think, okay, I'm okay now, it's normal for guys. No, it's not any normal. All right, it's not normal. And then this part is more for those who are young adults, those who are about to transition into maybe becoming fathers or mothers, where you get to have information about family planning. Plan yourself well. By this time, by the time we're talking about this, you should have been out of school and perhaps working, about to get married. Now, in some cases where you find girls who are already pregnant, young girls who are already having children, then we can talk about family planning for them. When someone is already sexually active, it may not be so easy to talk about other things that are not happening to them. The person, maybe she's had the first child, had the second child, then there are some other things that we can bring into that conversation. But until then, we'll keep talking about abstinence, which is key. Okay. All right. Now, there are also factors that have influenced sexual health. Individual factors, personal beliefs, attitudes, experiences, especially related to sexuality. So as you're growing up, there are some experiences some young girls have had in relation to sexuality that has changed their mindset for good or for bad. So that can equally affect your sexual health, right? And then again, relationship factors. What kind of relationship do you have with your parents, siblings, people around you? How do you communicate with them? These are things that can influence individuals' sexual health. And again, social and cultural factors. What are the social norms around you? What are the stereotypes that guide your community, your society, especially as it comes to sexuality? There are some areas where girls cannot get pregnant before they marry, right? Once you get pregnant before you marry, there are things, there are rules, there are regulations, there are restrictions, there are boundaries. And so for that kind of society, you find mothers, they keep harping on don't get pregnant, because they know what will likely happen to them or to the girl child or to the child. So social and cultural factors can influence sexual health. And then there are some areas where they don't care. All right, you can go get pregnant, they don't care. They have other rules that affect them, which may be mild. All right, so it may allow for girls to get pregnant more in that society without getting married. Then another factor that can influence sexual health is access to healthcare and education. And so that's what we are doing here. That's why we are doing this. You need to understand these things. You can't hear them once and say you have heard all, that you're okay with the information. No, we need to keep bringing the information to you. Information about sexual health. You need to keep asking your questions. You need to keep communicating about these things. And then you should have access to healthcare as well, services. There are some girls who don't have access to healthcare as young mothers, as teenage mothers, and because of that, they don't know what to do. And before long, you find them getting pregnant again because they were not properly tutored. So all they know is just to get pregnant. But with the right kind of information, you find them making some adjustments, lifestyle changes and all that. So this is what we are bringing here. And this is what we want you to understand today. Sexual health for you as a female, very important. It's the understanding, not just you understand, you equally appreciate all aspects of sexuality and its impact on your well-being. All right, so when you understand this, then you can make healthy lifestyle choices. You will make less mistakes. Yes, if you understand it, because it's a total thing. It includes your physical, your mental, your social, your emotional ability. All of those things put together will help you. Okay, now we'll go on a very short break. When we'll come back, we'll talk about the importance of sexual health, and then we'll wrap it up. Don't go anywhere. I'll be right back. All right, you are welcome back. If you just joined us, this is Life Class, and we are talking about understanding sexual health, and today we are taking it from the aspect of the females. Okay, but like I said, you can equally transfer the knowledge. All right. Okay, so the importance right now. One thing is sure, sexual health is very important, all right, to the overall health and well-being of individuals, as WHO has defined it. All right. Now, it's also important to emotional and physical well-being. And if you are emotional and physically well, every other thing can fall in line for you, because your emotions will help you make better decisions for yourself. Okay, and this will help you to make choices and decisions about your lives. You know what you want. It will help you have a clear note of what you want. You see your path clearly, and then you follow the one that will help you. Now, when all these things fall in line, there are just other things that you just need to add. Now, let me start with this importance that sometimes it tends to be the last, but you see, social and economic development, when it comes to sexual health, that is very important. Education and opportunities, when you have access to information, sexual and reproductive health information, and also other services that can allow females to plan their lives, it will help you. First of all, when you get the information, you know what to do, you know when to place boundaries, you know when to play some games and when not to play some games, because you know what can come out of it. Like, every young girl out there, one of the things you should do for yourself is not to get pregnant before while you are still in school. All right, you may see someone who got pregnant while in school and was able to still get through because of the support system the person has, but it may not work out for you the same way. We are not even talking about the health implications there, and also the economic opportunities there. You see, I've seen some girls who had children at home and before time, and their lives, they had to just make do with planning to take care of themselves and their daughters or their sons or their child, all right, because nobody's there to help them. And so it would have been a different thing if they had finished school and then at the appropriate time, work, then get pregnant, have a family and all that. And so the economic importance is there for every female. Money, it's not easy to make money as a single person or even as a married person, and then you are single and you have a child. So you see how it can affect your economic and social development. But if you just relax, take life according to the phases that they should go rightfully, at the appropriate time, it won't be a problem for you to be able to take care of your child. You'll be prepared economically. All right. Okay. And now also this The importance of sexual health is that it will equally help reduce maternal mortality. Do you know the number of girls who die during childbirth? Okay, and even children as well. So this information, it can help reduce maternal mortality. And as well, you see, we talk about equality and all that. I'm not going to talk about that, but if we want to address gender inequality in some things, then we should increase the knowledge of sexual health that our girls have. Okay, that is all I can say about that one. And then, like I already mentioned, your physical health is there, reproductive health, STI prevention, your overall health is also there. Your mental and emotional health is there. You're talking about your relationship health, talking about your well-being. And if other people can equally understand this, they will help us. If you can understand that if you rape a girl child, that it's going to affect her mentally and emotionally, perhaps for the rest of her life. If you understand that, then you're not going to take anything from her body without her consent. All right? And so if we understand that, even parents will be more protective in the sense that we bring information they need. Because sometimes, of course, you can't go with them everywhere. You can't be with them everywhere all the time. But you can give them information they need. And with that information, they can protect themselves. And when they need to talk to you, you are open for communication. You allow them talk to you, allow them come to you. And when they bring up something that seems alien to you, you want to understand it. You don't run them off. If she right? So it's only when they talk to us that we know what they know. They can keep a whole lot to themselves and we will never know. So is it not better we open this channel of communication first with our children at home? And then every other thing can be built on it, like what we are doing here right now can be built on the information, the prior information your children already have. So if we say anything out of norms, out of normal, they will come back to you and say, Mommy, I heard something like this. And then if it's something you have to correct, you correct that impression immediately. But if they have no foundation before that, and then every other person brings theirs, and the child can even get confused at the end. Okay, but this is it. Now I know sometimes when we talk about sexual, like I said, is large. It's not something we'll talk about everything all at once, but we try to bring the key ones you need to know, and then every other question you have can come in. Now we have laid the foundation. Every other thing that we want you to know can come on this foundation we have laid. And the same way, if you have any question, you can always bring it. I love when you ask questions. I love the feedback. I love your questions. And like I said, there are some things sometimes people don't want to talk about it here. There's no problem. You can always send a text message. You know, we'll always attend to you to 0703 006 6030. Let's deal with these things once and for all. Let's get the right information out there, so that when you are ready to make any kind of decision, it will be the right one. Thank you so much for joining me this afternoon on live class. Let us do this again next week Monday here. Madam Mas Pacos. Thank you for joining me.